The local healthcare organisation which I chose to visit was the Whittlesea Community Connections. It is a not-for-profit organisation. This presentation will discuss the objectives of the organisation along with the services they offer to those who live in the city of Whittlesea. It is important to address principles such as equity, social justice, and accessibility when looking at the services an organisation has to offer. These principles will be examined in how they are applied to the agency. Lastly, I will be examining the limitations of the Whittlesea Community Connections and providing my recommendations for future public health practice. The Whittlesea Community Connections provide an array of services to the community. The aims and objectives of the Community Connections is to ensure that everyone has equal access to the community's resources and services by offering services and programs that address disadvantage in the community and promote community participation and involvement. The services which the WCC provide are individual casework and group activities to assist new arrivals of Australia, free legal help to people who live, work or study in the city of Whittlesea, and financial assistance to residents of the city of Whittlesea who are in crisis and cannot meet basic needs such as bills, housing, food, transport and medical expenses. The Whittlesea Community Connections also assists with transportation facilities to those who experience transport-related disadvantage. Community transport can assist with health and medical appointments, essential community, welfare and professional services, social support or health group activities, essential food shopping and visits to friends and relatives at health or care facilities. These services provided are funded by grants and donations made by the public. In 2017, over $2.5 million was received by the Whittlesea Community Connections from grants. According to his article, Month states that public health is the science of preventing disease, prolonging life, and promoting human health through organised efforts and informed choices of society, organisations, communities, and individuals. The Whittlesea Community Connections has used the science of public health as a foundation for all their work. By offering the services that I mentioned earlier, the community of Whittlesea have improved access to services that will benefit their health outcomes. The Whittlesea Community Connection. Health equity is the absence of disparities in controllable and therapeutic aspects of health. Equity is demonstrated at the Whittlesea Community Connections through the community transport services. It recognises that there are people who face difficulty accessing transport, which in turn may worsen their health outcomes. These people are offered with this service so that they too can arrive to medical appointments, social support, or health group activities, and even essential food shopping. This improves the overall healthcare access that these people would not have had if it wasn't for the community transport services. As for social justice, the Community Connections looks at family violence, particularly towards women and children. Social justice is a concept that encompasses equal access to wealth, health, well-being, justice, and opportunity. The Whittlesea Community Connections collaborated with the Salvation Army Crossroads on the Hamdal project called Women's Health in the North and Orangan Community in the North. This project was funded by Our Watch. It is a toolkit for practitioners specifically looking at the community-based prevention of violence against women and their children. It was introduced to target the new arrival of the Iranian community to the city of Whittlesea. Alongside this, brochures were designed by a group of local women representing Whittlesea's diverse communities. They combined community expertise with agency knowledge to create a series of unique brochures that explore what family violence is, where to seek support, and address some of the myths and barriers that might stop someone seeking assistance. This project focuses on women and children as a vulnerable group in the context of family violence. Exposure to violence leads to poorer physical health overall compared with women and children who have not experienced violence. It also increases the risk of developing a range of health problems. An Australian study found intimate partner violence was the leading contributor to death, disability, and illness in Victorian women aged from 15 to 44. By providing this service to women and children, the community connection is providing them with a means of seeking assistance to ensure that they are not only safe, but also to ensure they receive better health outcomes. Whittlesea Community Connections provide a range of services to those in the community. These services overall are affordable, accessible, and available. All services provided are for free for those living in the city of Whittlesea. Those who are financially unstable are able to access these services just like any other person would. This ensures that those who are in need of such services are able to access them, resulting in improved health outcomes. The services at Whittlesea Community Connections are also accessible. The office is located in Epping Plaza. Bus stops are just opposite the road from the office. There are a total of 6 buses that stop in front of the office. These buses also stop at Epping train station, furthering the accessibility of Whittlesea Community Connections. The office is also wheelchair accessible. This information is listed on the website. In terms of availability, Whittlesea Community Connection services are readily available to those who are in need of them. Although the Whittlesea Community Connections provides access to services that better the health of those living in the city of Whittlesea, there are limitations that need to be addressed in order to further ensure better health outcomes. In the 2016 to 2017 annual report, it found that there was a need for increased coordination of organisation-wide prevention, planning, community education, and collaborative work. This could be achieved by assessing community needs and identifying issues negatively affecting the health and well-being of individuals, coordinating strategies to address the root causes of various social issues. For example, this could include family violence, gender inequity, gambling, social isolation, poor mental health, financial vulnerability, and crime, and to ensure residents have the tools and skills needed to become empowered and improve their own health and well-being. The report also revealed that the need to address an entry point for those living in Mernda. The aim of this entry point is a locally accessible information and referral service for people living in Mernda and surrounding areas. A single entry point for internal and external referrals, greater capacity to respond to people experiencing complex and multiple issues, legal telephone advice service where appropriate in casework and emergency relief appointments. This can be achieved by staff and community information volunteers at Mernda providing information and referral to local community members. Connecting people to relevant services, programs, and activities. They can undertake intake and assessment for people experiencing complex and multiple needs and providing supported referrals to different services as relevant and appropriate. The WCC are currently responding to clients in crisis situations and mapping local community information to build a local community directory of services, programs, and activities. This entry point will benefit those living in Mernda, as distance will no longer hinder their ability to access the services that the community connections provide. I have attached my references in the next slide as well. Thank you for listening to my presentation.